Hello and welcome to a brand new season of the show. I am Joe Abraham, producer of this podcast from the Pushpagiri Center for Health Communication and your host for today's episode. If you have been following us in the past, you will know that we have typically brought you interviews with public health professionals, experts, and change makers from the field. But starting this season, we are expanding our scope. We will still have interviews, of course, but you can also expect episodes where we unpack important public health issues, dive into the latest research, and help you make sense of the topics that affect our health at the community and population level. And today's episode is exactly that kind of deep dive. We are tackling a question that's been making headlines. Are ultra-processed foods shortening our lives? It's a topic that touches not just individual choices, but also broader public health policies, food systems, and even economics. So let's get started. We have all grown up hearing that junk food is bad for us, right? That's nothing new. But in recent years, scientists have started to use a more precise term, ultra-processed foods or UPFs. And the evidence is mounting that these foods might be doing much more harm than we previously realized. First, let's clarify. What exactly are ultra-processed foods? According to the NOVA classification system, which is widely accepted in nutrition science, UPFs are industrial formulations made mostly from substances extracted from foods, combined with additives you wouldn't normally use at home. Things like artificial flavors, colorants, sweeteners, or emulsifiers. They are designed to be convenient, tasty, and cheap. But they are often high in calories, low in nutrients, and they tend to push healthier, minimally processed foods out of our diets. Examples include supermarket bread, most breakfast cereals, packaged snacks like chips and cookies, sugary drinks, instant noodles, and processed meats like sausages and hot dogs. And here's the eye-opening part. In many high-income countries, ultra-processed foods now make up over half of the average person's daily calorie intake. And even in lower-income countries, their consumption is rising fast. Now the big question, what does the research say? A recent study published in the American Journal of Preventive Medicine pooled data from over 239,000 people across 7 studies. And what they found is striking. There's a clear linear link between UPF consumption and risk of death. Every 10% increase in calories from UPFs is associated with a 2.7% rise in the risk of dying from any cause. To put that in perspective, in countries like Colombia and Brazil, where UPFs account for less than 20% of daily energy, about 4% of premature deaths were linked to these foods. But in places like the US and UK, where over half the calories come from UPFs, that figure jumps to around 14%. In raw numbers, that's over 124,000 premature deaths in the US and nearly 18,000 in the UK in just 1 year, 2018. So what makes UPFs so harmful? Well, yes, many are high in fat, salt, and sugar. But researchers believe the issue goes deeper. UPFs tend to be nutritionally unbalanced, they displace healthier foods, they contain various additives, and their hyperpalatable nature encourages overeating. Of course, we should note that this research is observational, meaning it shows associations, not definitive cause and effect. And measuring UPF intake isn't perfectly precise either. Plus, not everyone agrees on the UPF definition. Some industry groups argue that the term lumps together a wide range of foods unfairly. Still, the body of evidence is growing, and it suggests that cutting back on UPFs could significantly reduce the risk of disease and early death. For every 10% cut in UPF calories, there's that same 2.7% drop in mortality risk. Now, making these changes isn't always easy. UPFs are cheap, convenient, and tasty. And for many people, they make up a significant part of daily life. But even small swaps can help. Choosing whole grain oats instead of sugary breakfast cereals or fresh fruits over packaged snacks. And beyond personal choices, this is also a public health challenge. As experts suggest we need policies like healthier food environments, taxes on UPFs, stricter marketing regulations, especially for kids, clear front of pack labeling, and subsidies to make fresh local food more affordable. So, in summary, the rise of ultra processed foods is more than just an individual dietary issue. It's a major public health concern. Tackling it will take both personal and policy level action. That's our deep dive for today. I hope it gave you some food for thought. No pun intended. Once again, I'm Joe Abraham, producer of this podcast for the Pushpagiri Center for Health Communication and your host for today's episode. If you found this useful, please consider subscribing and sharing it with friends or colleagues. And stay tuned. This season, we have got more episodes coming your way, covering key public health issues and some insightful interviews too. Until next time, take care and make informed choices about what's on your plate.